Okay, let's talk about our vasodilators and treatment of angina pectoris. How do you define angina pectoris? Again, how do you define angina pectoris? Let's see. Okay, so angina pectoris is chest pain, that is correct. And most of the time, it's due to lack of oxygen in the heart mismo. Okay, the problem is in the heart. So it's actually a kind of ischemic heart disease. When you say ischemic or ischemia, there is a reduced blood supply in the heart mismo. Okay, so if there is a reduced blood supply in the heart, then that means there is also a deficiency in or insufficient amount of oxygen. So remember, our heart is a muscle, and for a muscle to function, it also needs oxygen. Now, if there is reduced blood supply, then we have a problem with our heart. We call that ischemic heart disease. So this ischemic heart disease is also called atherosclerotic disease of the coronary arteries. Okay, or we just simply call it coronary artery disease. So these arteries are found in the heart mismo, and we have a problem with them. Pwedeng merong atherosclerosis. So how do you find atherosclerosis? It's a deposition of plaques in the walls of the arteries, leaving the arteries narrow. So magna-narrow yung pathway for the heart to flow. So to compare, we have here a normal artery, thus we have a normal blood flow here. And on the right side, we have an atherosclerotic plaque deposited in the wall of the arteries. Okay, so this one is being narrowed, and therefore we will have a blockade in the blood flow. And that means there will be a reduced supply of blood in the heart, leading to insufficient supply of oxygen. So what is this atherosclerotic plaque? Atherosclerotic plaques are made up of cholesterol, okay? This is cholesterol class, and in its interaction with calcium, si cholesterol kasi titigas, okay? It will be hardened, and at the same time, madedeposit siya on the artery. So everything boils down actually with the increased amount of cholesterol in the blood. Okay? So ito yung problema talaga natin with the narrowed arteries. You have too much oxygen too much cholesterol in your arteries. So after that, if there is a reduction in the blood supply in the heart, the patient may experience angina pectoris. So when you say angina, there is a sudden, makalit lang, no? And then severe crushing chest pain. And that chest pain class, sa kasakit ana, it may radiate to your neck, as in kasali yung neck part, the jaw, your back actually masakit din, and the left arm. Okay, so that's angina pectoris. That's how you know that it's your heart na merong problem. Because I remember I mentioned last time, you may have also chest pain. For example, you experience heartburn or the so-called gastroesophageal reflux disease. Pag magre-reflux ka with your acid, you may experience chest pain also. But you may differentiate angina pectoris because it's very painful that kasali yung left hand mo, yung back part, your neck, and even your jaw. Okay? So aside from the chest pain, syempre the patient may experience dyspnea, there will be difficulty in breathing, and pwedeng mag-experience ng indigestion. If you can still remember the video about heart attack, di ba? Before the patient class, before niya masabi talaga na nagha-heart attack siya, feeling niya nag-i-indigestion lang siya. Parang masakit yung tiyan na parang hindi natunawan. That's how it starts, okay? And then there will be also nausea and vomiting or diaphoresis. Diaphoresis is excessive sweating, okay? There will be excessive sweating. So what's the cause of the chest pain experienced by people with angina pectoris? This one, there will be an imbalance between the oxygen requirement of the heart and with the supply. So this is just like studying like economics. Diba? Sa economics, we have blood supply. We have demand and supply. So yung heart natin, meron siyang demand for a certain amount of oxygen for it to function well. Now, kailangan yun siya masupply. However, in angina pectoris, there is still the demand. However, we have a problem with the supply, okay? We have a problem with the supply of the blood in the heart. Again, the problem is there is a blockade in the blood flow because of the atherosclerotic plaque being deposited. Now, we have different types of angina. We have classic or typical. Ito, classic-classing name niya yan ha. Parehas lang yan sila. Classic, typical, stable, or effort-induced angina. Parehas lang yan sila lahat. And then we have unstable angina. And then ito naman, parehas lang ito sila lahat. Different names lang ito. Prince metal, variant, vasospastic, or rest angina. And lastly, we have the acute coronary syndrome. Now, let's talk about them one by one. Let's start with classic angina. Yung sa classic angina, syempre chest pain pa rin. So there is short-lasting burning, heavy or squeezing feeling in the chest. Okay? And then the patient may experience, aside from the chest pain, you have the extreme fatigue, nausea, and diaphoresis. Now, how do we treat classic angina? This one is being treated by rest. Bakit? Di ba tinatawag itong effort-induced angina? The patient will have the chest pain. Again, the patient will have chest pain after having like too much work, too much exertion, too much exercise, more than ordinary activities. So yun yung mangyayari sa patient. After doing this like strenuous exercise, more than ordinary activities, the patient will have the chest pain. So this type of angina may be treated or pwede siyang mawala if the patient will rest. Okay? Pwedeng i-rest lang kasi effort-induced angina naman siya. Or if the patient wants to have medication, we may use our nitroglycerine. So remember class, our nitrates are considered vasodilators. They are direct vasodilators. So one example of our nitrates is the nitroglycerine. So what is the cause of this classic, typical, or effort-induced angina? Ganun pa rin. There is a reduction in the blood supply in the heart. So definitely there will be reduced amount of oxygen also. And the obstruction in the blood flow may also be due to atherosclerosis. Okay? Now, how about unstable angina? Sa unstable angina, even without exertion, even without doing anything, class, the patient may experience chest pain. So, hindi ito effort-induced. Therefore, this cannot be relieved by just resting. Okay? So, there is still the chest pain. However, mas masakit ito compared to the stable one, the effort-induced angina. There will be increased frequency. When you say there is increased frequency, mas madami yung kanilang like attack or episodes. Mas madaming example sa isang araw, mas maraming chest pain yung ma-experience nila. And then the duration is also increased. Therefore, mas matagal ma-experience ng patient yung chest pain. And so does the intensity. So yan yung sinabi ko kanina na mas masakit ito compared to the stable one, the effort-induced angina. And then again, this is not really like precipitated by effort. Okay, even the patient is resting, he or she may experience chest pain. So ulitin ko lang, we cannot relieve this by just resting. So oftentimes this requires hospitalization. Kasi medyo matagal yung chest pain hindi talaga siya basta-basta nawawala. And this is very painful. So again, this may require hospitalization and more aggressive therapy. So like maraming mga vasodilators and other treatment required just to alleviate the chest pain. Okay? And then thirdly, we have the Prinzmetal angina, or we call this Vasospastic angina. So sa Vasospastic angina, there is like a localized spasm. Diba, if you have your blood vessels, okay, this is your blood vessels, like portions of the blood vessels class will experience spasm. What do you mean by spasm? What do you know about spasm class? Pag nag-spasm, ano nangyayari dyan? Sige daw, ano nangyayari dyan? Wala ka antipara, kailangan dyan ako madool. Involuntary muscular contraction. Yeah, when you say spasm, there is involuntary contraction of the muscle, and it's sudden. So remember, our blood vessels are also muscles, smooth muscles nga lang. So magko-contract din yan. Now, pag mag-undergo ng spasm, portions of these blood vessels will contract. So, yung contraction is mabilis and it will impede blood flow. Remember, pag nag-contract na siya din haog paspas, paano na yung blood flow dyan? Okay? Magkakaproblema with the blood flow. Thus, the patient will still experience chest pain. Kasi makukulangan din yung blood supply in the heart. Okay? So, yung pag nag-spasm class, di ba pag example, nagsakit imuhang tiyan, kita mo na experience sa buskupan na the patient experiences spasm sa iyahang gastrointestinal tract. So, ang meaning class, there will be a sudden, involuntary, and yung grabe na contraction of the gastrointestinal tract, kaya masakit yung tiyan mo. That's spasm. So, ganun din yung mangyayari with the blood vessels. Okay? So, bakit magsispasm yung mga blood vessels? Actually, that is still because of the atherosclerotic plaque. Because of the deposition of the cholesterol there, that's just a body mechanism na magkakaroon ng contraction kasi ano yun siya, foreign substance na not really foreign substance because cholesterol is actually part of our body, no, pero foreign in terms na hindi kasi dapat siya doon, hindi siya dapat naka-deposit doon, so the body will really react, and ito na yon, there will be spasm. Okay, so ito ang tawag natin dito is Prince metal angina. Okay, so how do we treat Prince metal angina? We may still use vasodilators. So example, NTG is nitroglycerine. And syempre, you know CCB, what CCB is. CCB is calcium channel blocker. Okay, and lastly, we have coronary artery syndrome. This is, iba yung coronary artery disease. Kapag nag-deposit lang doon yung cholesterol, wala pa namang nangyayari. Like, nandun lang siya. And then, though pwede siya mauwi into like heart failure or angina, that's coronary artery disease. But what happens if the patient will have coronary artery syndrome? So this one is an emergency case. So you have your blood vessels, and then you have an atherosclerotic plaque here. What will happen to the atherosclerotic plaque? There will be rupture. So magra-rupture yan siya. Actually, yun yung nakita niyo during the heart attack. Diba, the person there, yung lalaki doon, meron siyang atherosclerotic plaque in the blood vessel. And then because of like nag-soccer siya, diba? So pag nag-soccer, that's considered a heavy exercise. Mabilis yung blood flow. Mabilis ang blood flow niyan kasi mataas yung demand ng body mo for oxygen. So ang mangyayari because of that increased blood flow, mai-injure kasi itong atherosclerotic plaque. When I say ma-injure siya, pwede siya magisi, pwede siya mag-lyse, o kaya mag-rupture siya because of the pressure. Okay? So pag nag-rupture yan siya, whether partial or complete, syempre, this is considered an injury. Diba pag may injury ka, magre-react man talaga ang body natin. So example, yung ating platelets. Okay? Magre-react ang platelets dyan. Kasi this is considered injury. Didikit yung mga platelets dito. Okay? So pag nadikit dyan, that is to create clotting, no? Kasi injury nga siya. So pag nadikit yan dyan siya, yung mga platelets na yan, that will further lead to the obstruction of the blood flow. Meron na ngang plaque, dumikit pa yung mga platelets, nagkaroon pa ng clotting or thrombosis, talagang wala nang madadaanan yung blood natin. Okay, coronary artery syndrome. Yan siya. And because wala nang madadaanan yung blood, this may lead to heart attack, or that is what we call myocardial infarction or MI. So yun yung nangyari doon sa video I showed you about sa heart failure, no. Nagkaroon siya ng coronary artery syndrome. The atherosclerotic plaque was ruptured, and because of that, there was thrombosis or clotting, and thus leading to, as in the closing of the pathway of the blood. And then, ayun na, nag-myocardial infarction na siya. Okay? Do you have questions about our different types of angina? So, iba-iba lang sila ng types, pero actually, ang cause nila pareho lang, na merong atherosclerotic plaque, hindi na masyadong makadaan yung blood. So, konti na lang yung aabot in the heart muscles, makukulangan ng oxygen. So, ischemia pa rin. Yun siya. So, because of that, there is chest pain. Magkaiba lang sila, yung isa because of effort, Kaya tinawag natin siyang effort-induced angina or stable angina. So, ire-rest lang natin. Yung isa, kahit hindi walang exertion, the patient may still experience chest pain. Yun yung unstable angina. So, any time of the day, the patient may experience chest pain. So, oftentimes, yun yung nagre-require ng hospitalization. And then you have your vasospasm or vasospastic angina. May mga portion lang of the blood vessels na magsuspasm. And masakit din yun. Okay? Kasi may problem dun sa blood flow. And then yung coronary artery syndrome, kapag ka nag-rupture na talaga yung atherosclerotic plaque leading to formation of clots, and then after that, myocardial infarction. Wala question? I hope nagkasinabot na sa to ang different types of angina. Wa mo natulog din ha. Okay, kailangan mamawi sa midterm ang mga dapat magbawi. Kasi though hindi ko talaga napasa yung grades, pero looking at your score, talagang merong alanganin doon. As in alanganin. So, graduating man kayo, kailangan niya talaga magbawi sa midterms class. So, wala magtulog-tulog din ha. Okay, let's talk about pathophysiology of our angina. So, meron tayong tinatawag na determinants of myocardial oxygen demand. So, remember sabi ko kanina, studying angina is like studying economics. Demand and supply. So, merong demand yung ating heart for oxygen. And this one will determine the demand of the heart sa oxygen. So, we have here the wall stress. When you say wall stress, we are talking about our blood vessel here. Our blood vessels. So, like our intraventricular pressure, the blood pressure itself will determine how much oxygen do we need for our heart, the ventricular radius, okay, kung gaano kalaki yung ating blood vessel, including the wall thickness class, will also determine the oxygen demand. So, syempre kung malaki yan, maraming blood yung kailangan mag-flow dyan. Yung sa heart natin, I mean, the wall stress also refers to our heart, ha? Yung wall mismo ng heart natin. Yung pressure dyan, yung gaano kalaki yung ating vessels, and at the same time, yung ating muscles doon sa heart. Siyempre, the more na malaki, the more na mataas yung demand dyan. Yung thickness pa niya, okay, ng wall natin. Kasali pa yon. Kasi the more na thick yan, that means the more na malaki din yung heart muscles. So, that definitely will have greater demand for oxygen. And then the heart rate, kung mabilis yung heart rate natin, meaning magdo-double din, no? Bibilis din, and dodoble yung kanyang demand for oxygen kasi magtatrabaho siya ng as in greater than the normal kung mataas yung heart rate. So definitely mataas din yung demand niyan for oxygen and the contractility. So kapag the heart needs to really push, and then mataas na force yung kailangan niya doon, syempre kailangan niya din ng maraming oxygen. So kapag ito tumaas lahat, tataas din yung demand. Therefore, the relationship here is directly proportional. So when I say directly proportional, pag mataas ang heart rate, mataas din yung oxygen demand and all the other things there. Directly proportional sila. Now, ito naman ang determinants of coronary blood flow and myocardial oxygen supply. This one is for the demand, this is for the supply. Paano natin malalaman kung gaano karami yung pwedeng isupply na dugo doon sa heart mismo? So, itong supply is directly related to the perfusion pressure and the duration of the diastole. So this is actually talking about the aortic diastolic pressure. So remember class, yung heart, 'di ba? yung heart natin, class, magre-relax ito. Pag-relax niya, mag-stretch yung kanyang mga muscles. And because of that, this will allow, again, mag-a-allow siya na papasok yung dugo inside. Tapos magko-contract na naman siya. Pag-contract niya, yung heart na nasa right ventricle papasok sa lungs para maging oxygenated yung blood. And yung iba naman na nasa left ventricle na syempre i-distribute na sa body. So kung okay lang yung diastole mo, yung duration ng diastole, normal, and then yung pressure class is also normal. So definitely, magsusupply siya ng enough oxygen, enough blood on the heart. So enough oxygen din yan siya. Pero yung supply ng dugo sa heart class is inversely proportional to coronary vascular bed resistance. So what do you mean by that? It's actually on the blood vessel. Siyempre, pag mataas ang resistance dito, it means, pag magre-resist na kasi yung blood vessels natin, class, they really have the ability to resist the blood flow. Na pag mataas yung resistance dyan, meaning yan, hindi makadadaan yung dugo and mababawasan yung supply. So kaya tinatawag siya dyan na inversely proportional. So when is the time na magre-resist yung blood vessels natin ng blood flow? Siyempre, during merong atherosclerotic plaque. Kasi merong merong obstruction in the blood flow. So definitely magre-resist yun siya. Okay? Ito yung mga determinants natin for the myocardial oxygen supply. Now, kailangan mabalance kasi yung demand and supply. That's why we are studying economics, diba? Mabalance yung demand and supply kasi like tataas ang presyo, ganun. Ganun yung sa economics. Pero dito sa atin, sa heart, i-balance din natin ang supply and ang demand. Na pag magka-problema tayo either in the demand or the supply, that's the time we'll have angina. Now, ito yung mga drugs for angina. Kasi hindi lahat ma-relieve sa rest. Yung stable angina lang yung pwedeng ma-relieve sa rest. Okay? So, kailangan natin ng help ng drugs. Now, yung drugs natin for angina, class, yung kanilang action, dalawa din. Pwedeng doon sa demand, pwede din naman doon sa supply. Okay? So, again, pwedeng decrease myocardial oxygen requirement by decreasing the determinants of oxygen demand. Okay? So ano yung pwedeng gawin para mapababa yung demand? So ito this is to decrease the demand. So that's the first action ng mga drugs for angina. Para ma-decrease natin yung demand ng heart, yung requirement ng heart sa oxygen, pwede nating ibaba din yung heart rate, yung ventricular volume, ibaba yung pressure, and even the contractility. So, we will actually see the same drugs that we use for heart failure and even for hypertension. Remember, pag ibaba mo si pressure, most likely bababa din yung demand for oxygen in the heart. Yung pagbababain mo yung heart rate, ganun pa rin. Nakita na natin yan in the study of heart failure and hypertension. So, pabalik-balik lang yung mga drugs dito. Okay? So, what are the examples of drugs that can decrease the demand of oxygen in the heart? Okay. Ito yun. Our organic nitrates. Mga nitrates natin, class, can decrease the demand of oxygen in the heart. So what is the example? We have our prototype drug here. Our first drug, nitroglycerine. Now, our first problem with nitroglycerine is it has a very extensive hepatic first pass effect. So what do you mean by first pass effect? Ito yung drugs, class, na kakainom mo pa lang, hindi mo pa siya nagagamit, na-metabolize na siya for excretion. Because remember, we have a duct connecting our intestine and our liver. Okay? And kahit hindi mo pa na-absorb yung drug, hindi pa siya nagagamit, hindi pa siya napunta doon sa target site, ma-metabolize na siya. So yan yung nangyayari kay nitroglycerine. Pag inom mo, if you take nitroglycerine orally, ano siya, agad siyang mamametabolize ng liver enzymes. So it has a very low oral bioavailability. Uminom ka ng, for example, 500 milligrams of nitroglycerine, masyadong maliit na lang yung matitira kasi na-metabolize na siya and ready na siya for excretion. Therefore, we don't give nitroglycerine orally. Most of the time, this is via transdermal patch. So, yung delivery system niya, drug delivery system niya is via the transdermal route through a transdermal patch. Pwede din siya via intravenous injection. Ayun, kasi pag intravenous injection naman 100% bioavailability yun kasi diretso na siya sa blood. Pero orally, may problem tayo. Yes, isosorbide dinitrate is included here in our organic nitrate. So aside from nitroglycerine, we have the ISMN or the isosorbide mononitrate. We have the brand names here. The ISMO, or ito yung I think mas common in the community, the Endure. Okay? So this is, the isosorbide mononitrate is an active metabolite of the dinitrate. And ginagamit natin siya for prophylaxis. So basically, if the patient is being prescribed with ISMN, the purpose is for the prevention of the chest pain. Okay? Magiging maintenance drug niya ito, iinumin niya si ISMN araw-araw, again, to have the blood vessels dilated. Kasi vasodilators itong mga organic nitrates natin. So pag nag-dilate yung blood vessel, most likely okay yung blood flow. Kasi malaki yung daanan ng blood. And that means, mapaprevent natin yung occurrence ng angina or yung chest pain. Kasi okay naman yung blood flow. So, si ISMN, galing lang din siya kay ISBN. Okay, low bat. Wait. Wait lang. Okay, how about ISDN? ISDN is as isosorbide dinitrate. So ito yung common brand name in the market, the Isordil, the pink one, the very small sublingual tablet. So this drug, its action is almost similar or very similar to nitroglycerine, but it has a slightly longer duration of action. And it has the advantage of like pwedeng oral, pwede siyang ibigay orally kasi si nitroglycerine talaga, hindi mo talaga siya mabigay orally, no? Kasi nga sa extensive na first pass effect. Ito pwedeng orally, and we have the sublingual tablet in the market. But remember, pag sublingual, ilagay mo siya under the tongue kasi dediretso yun. We have a blood vessel under the tongue na mag-a-absorb ng drug. So diretso siya sa blood. And kung nasa blood na kasi siya, remember, magkakaroon na ng action. So there will be dilation of the blood vessel. So unlike the ISMN, si ISMN is for prophylaxis. Si ISDN, especially the one that is given sublingual, most likely this is given during the attack. Okay? So nandyan na yung nandyan na yung chest pain. And then, para mawala yung chest pain, pwede nating ibigay si ISDN sublingually. Okay? Now, meron pa actually isa na organic nitrate, and we call that amyl nitrite, which is very highly volatile na liquid, and dati binibigay siya inhalational. So inhalation ha. Inhalation yung kanyang drug delivery system. However, unlike the 3, amyl nitrite is no longer used in therapy because number 1, since this is inhalational, it has a very unpleasant odor. And number 2, it has a very short duration of action. Remember, this is highly volatile. So it has a very short duration of action. Parang wala lang din. After some time, na-metabolize na siya and then na-excrete na. So, very short yung kanyang duration of action. So, mas pinipili natin yung drug na merong magandang pharmacokinetic profile. Okay, so just like ISD and ISMN and even the nitroglycerine. Okay, so paano ba nadadilate yung blood vessels? Kasi pag sinabing organic nitrates class, automatic yun. Magkakaroon ng dilation of the blood vessels kasi vasodilators nga sila. Okay? So, ganito yung mangyayari inside the body. If you give the patient nitrates, inside the body, it will become denitrated. Matatanggal yung nitrates class, that's denitrated. And ang gagawa nun is the glutathione S transferase. Okay? Glutathione S transferase is the enzyme needed here to denitrate the nitrates. The purpose of denitrating the nitrates is to release the nitric oxide. So the drug itself class, si nitroglycerine inside the body, magiging nitric oxide siya. Okay? Si nitric oxide, remember, is a well-known na vasodilator. Our body can produce nitric oxide. Pero to have more nitric oxide, we can give the nitrates. Now, paano si nitric oxide makaka-cause ng vasodilation? We have here, the presence of nitric oxide will activate this enzyme. So this is the name of the enzyme, guanylate cyclase. Na pag ma-activate na ang enzyme na ito, this enzyme is used to convert GTP to cGMP. So GTP means guanosine triphosphate. Again, GTP means guanosine triphosphate. Na mako-convert siya into cGMP. What do you mean by cGMP? cGMP in pickle is different sa cGMP sa manuf ha. So cGMP sa manuf, that's current good manufacturing practices. Itong cGMP sa pharmacology, since this one is a substance inside, endogenous substance, hindi yan siya cGMP na current good manufacturing practices. This is cyclic guanosine monophosphate. Okay? cGMP-C is cyclic, G is still guanosine, and then monophosphate. Si GTP is kapamilya ni ATP. ATP is just adenosine triphosphate. Ito naman is guanosine triphosphate. So in the presence of the guanylate cyclase, it will be converted into cGMP. And the presence of cGMP will activate this enzyme. So cGMP-dependent protein kinase. Okay, this is another enzyme here. cGMP will activate the cGMP-dependent protein kinase. So activation of this PKG, protein kinase na cGMP dependent, will result in the phosphorylation of several proteins in the body, especially in the blood vessels, that reduce intracellular calcium, causing smooth muscle relaxation. So if this is your blood vessel, nitric oxide is being produced. Because of nitric oxide, guanylate cyclase will be activated to convert GTP to cGMP. Pag andyan na si cGMP, another enzyme will be activated. Pag na-activate si protein kinase, may mga proteins pa dito class in our blood vessel that will also be activated or phosphorylated. Tapos ang mangyayari, yung blood vessel class will have reduction in calcium influx. So supposedly, di ba, calcium will move inside the cell And then, remember, calcium is very important in muscle contraction. So, our smooth muscle, our blood vessel is a smooth muscle. So, para mag-contract yan siya, kailangan yan ng calcium. Ang problema natin, class, pag maraming calcium supply sa cell, sa blood vessel, magko-contract itong blood vessel na ito. And that means, sabi ko sa inyo last time, contraction means constriction. Okay? Pag nag-contract yung blood vessel, magkakaroon ng constriction yan siya. Siyempre, pag magko-contract yan siya, yung dadaanan ng blood, liliit. So, ang gagawin, ito yung mga proteins class, ma-activate yan siya. Tapos, yung daanan ng calcium, papuntang cell, magiging like close siya, magkakaroon ng reduction ng pagpasok ng calcium inside. So definitely, there will no be contraction. Instead, magre-relax yung blood vessel. Pag nag-relax yan, like this one, hindi siya klaro. Pag mag-relax yan, syempre, bubuka yan. And then, lalaki yung daanan ng blood. So that's how our organic nitrates class produce vasodilation. Okay? Do you have questions about the mechanism of action of our nitrovasodilators? Kasi pag quizzes and exam, yan naman talaga ang hinahanap ko. Always, almost all of the time, talagang nag-a-ask ako ng mechanism of action. Wala. Sure? Sure na yun? Hindi na siya mag-move. Okay. Ayan na. So, what's our clinical application for our organic nitrates? Syempre, they are used for angina. The sublingual form of our nitrates, not just ISDN ha. ISDN lang kasi yung like pinakasikat na sublingual. Pero yung ibang nitrates natin class, meron din naman silang sublingual na form. Pero pag sublingual na form class, sabi ko kanina, binibigay siya during the attack. So as you can see, angina, sublingual form is used for acute episodes. So if there is like chest pain, you may give the sublingual to alleviate the chest pain. The oral and the transdermal patches or forms are used for prophylaxis. So, sabi ko din siya kanina, ISMN orally given, the isosorbide mononitrate that is orally given is used for prophylaxis. And so is the transdermal patch. Yung transdermal patch, dinidikit lang siya syempre sa skin, and then the whole day, the patient will have the supply of the nitrate. So, that is to prevent ng chest pain kasi nakadilate yung mga blood vessels. And then, syempre, the intravenous form is used for acute coronary syndrome. So, remember yung acute coronary syndrome kanina, ito yung there is a rupture already of the atherosclerotic plaque leading to clotting and may lead to myocardial infarction. So that is an emergency case. So definitely hindi na natin hintayin si sublingual form na ma-absorb, si oral and si transdermal patch na ma-absorb din yung drug, no? Hihintayin pa natin yun na this is an emergency case. So we need the intravenous form for that. Okay? So definitely class, our nitrates are actually used for angina. Iba-iba lang sila ng gamit depende on their delivery system. Okay? Now, what's the adverse effects of our organic nitrates? Now, since there is vasodilation, di ba, pag mag-vasodilation naman yan, automatic yan bababa ang blood pressure. So, kasi masyadong, malaki yung daanan ng ating blood, hindi niya kailangan ng force, ng malaking force or pressure to push the blood to flow. So, there will automatically be hypotension. So most of the time, it's orthostatic hypotension. Orthostatic hypotension is related to your position. Like nakaupo ka, bigla kang tatayo, ganon. magkakaroon ng sudden drop in the blood pressure and you may experience like fainting. And then there will be tachycardia. Class, mag-partner kasi yan siya. That's our body's mechanism. So pag bumaba yung BP mo, automatic, the patient may experience tachycardia. Kasi that's our body's attempt to to balance the decrease in the blood pressure. Kasi hindi din naman normal yung decrease in the blood pressure, di ba? So to get rid of the decrease in the blood pressure, ang ginagawa ng body natin, nagtatakicardia talaga. Magre-release yan ng maraming norepinephrine para bibilis yung heart rate to compensate the decrease in the blood pressure. So partner yan siya most of the time. Pag nag-decrease ang blood pressure, talagang may tachycardia. And take note, the headache. I-highlight talaga natin yan. Example, nakapatch yung patient the whole day. Nakadikit yung nitroglycerine patch the whole day, no? So meaning yan the whole day, meron siyang nitroglycerine supply in the body, and then that the whole day, since merong nitroglycerine, nag-dilate yung kanyang blood vessel. And I don't know, I have mentioned, I think, sa inyo, when you have headache class, that means the blood vessels in your head is experiencing dilation. Okay? Pag nag-dilate kasi yung mga blood vessels natin dito sa ulo natin, nasi-stretch yung mga pain receptors. So, syempre yung blood vessels natin yan, kadikit ng skin yan. Nasa skin natin ito. And sa skin natin, doon natin makikita yung mga pain receptors na yan. Na pag lumaki yan, lumaki yung mga blood vessels, yung mga pain receptors natin sa ulo, mas-stretch. Okay? Mas-stretch sila. And definitely that will be painful. Kaya kapag nagbigay ka ng nitrates, nakadilate yung mga blood vessels, hindi lang naman sa heart yung merong nitroglycerine, all over the body merong nitroglycerine, for example. So yung sa ulo natin na blood vessel class, nadadilate yan. Kaya meron talaga yung headache. That's our problem with giving nitrates to our patient. Masakit ang ulo nila. Okay? Questions or clarifications? So definitely class, pag masakit ang ulo ninyo, masakit ba? Pero may masakitin yung ulo. Pag sakitin yung ulo class, you are experiencing vasodilation. Okay? So example, yung masyadong mainit. Siyempre pag masyadong mainit, magre-react yung body natin. Magva-vasodilate yan to increase the blood flow in the body. So kaya masakit ang ulo mo. Nagda-dilate yung mga blood vessels. Sa migraine, it's like iba yung migraine kasi magko-constrict muna siya. Kaya yung migraine merong aura. Alam mong magma-migraine ka na. I don't know about you, but mine has an aura. Like mag-blurred yung vision mo, may makikita kang something, lebron may mga stars ang imuhang vision. That's aura class. So I will really know na padulungay na ako mag-migraine. So during that time, there will be sudden vasoconstriction. And then after the vasoconstriction, there will be a rebound vasodilation. Pag rebound na yan siya class, severe pa yan compared to the normal vasodilation. Kaya kapag ka nagma-migraine talaga, kayo talagang masakit. Kasi grabe yung vasodilation yan. And one thing about migraine is it's one-sided. So kapag ka masakit ang ulo mo tapos one-sided, unilateral kasi yung ating migraine. So most of the time, one half lang yan siya. Pwedeng the left side or the right side. That's migraine. Okay? So ito, there will be throbbing headache. Pag throbbing headache, mo na siya ka na nagapitik-pitik gani ang sakit sa imuhang ulo. I don't like that. Magpitik-pitik imong ulo. That's one adverse effect of our nitroglycerine. Okay, any question or clarification about that? Wala. Tapusin ko lang itong hanggang other nitrovasodilators and then let's have a little break. CR break and whatever. Water break para makaginhawa ta. Sige, let's talk about another problem with our nitrates. We have here the tolerance. Okay? Again, tolerance. The patient class may experience tolerance or tachyphylaxis. So, di ba, ang ating nitroglycerin can dilate the blood vessel. However, isolated smooth muscles here in our blood vessels may become tolerant to the effect of the nitrates after some time. So, hindi na siya magdadilate, hindi na siya maapektuhan. Yung mga receptors dyan, hindi natatablan ng nitric oxide. Hindi natatablan ng nitrates. So, wala nang mangyayaring vasodilation. That's what you call tolerance class. So, at certain point, pag nag-experience na ng tolerance yung patient, you may have to increase the dose. Kasi at normal dose, wala na siyang effect. Okay? That's the problem with nitrates. So as we go along the treatment, kapag long na yung exposure ng patient doon sa nitrates, nag-i-increase yung kanyang dose. And then another thing is the Monday disease. Meron kasing parang on and off period yung ating nitrates na tinawag na lang siyang Monday disease kasi pag Monday masakit ang ulo. Actually, this has become a problem of workers exposed to nitrates production. So example, manufacturing company. Sa manufacturing company na yan, nagpo-produce sila ng nitrates, whether nitroglycerine, ISMN or ISDN. Tapos napansin nila na sa manufacturing company na yon, every Monday masakit ang ulo ng mga trabahante nila. Kaya tinawag nilang Monday disease. Bakit yon? Kasi class, ang nangyari doon, Monday to Friday, syempre mag-work sila. Exposed sila sa nitrates. Kaya hindi nila ininom yon, pero they are being exposed to nitrates class. Meron silang nitrates sa body for Monday. Kung hanggang Sabado pa yung trabaho nila, like Monday to Saturday, meron silang nitrates in their body. Okay? Now, ang problem, pagka Sunday, day off nila, wala silang work, napahinga yung kanilang body from the nitrate exposure. Tapos, pagka Monday, ayun, biglang meron na namang nitrate sa body nila. So, ang mangyayari nun, nagkaroon na naman ng dilation. So, kaya, pagka Monday, masakit yung ulo nila. Kasi nagpahinga ng Sunday, tapos biglang Monday, meron na namang nitrate yung body. So, ang Monday disease is talking about every Monday, merong headache. Okay? Pero it's not really, it's not really necessary na Monday. Naging Monday lang siya kasi nga, this is referring to the workers involved in the production of the nitrates. Itong headache, pwede siyang ma-experience ng person talaga. Like the whole day naka-nitroglycerine patch siya, tapos sa hapon naubos na yung nitroglycerine niya, so yung body niya like wala nang supply ng nitroglycerine. Tapos pagkatapos magna-nitroglycerine naman siya, kung after some time, ayan, sasakit yung ulo niya. Okay? That's Monday disease. So this is referring to the headache caused by the nitrates. Okay? So aside from our nitrates, we have other nitrovasodilators. Example dyan is the nicorandil, which is a nicotinamide nitrate ester. So nitrate pa rin ito, meron lang siyang difference in its structure. So meron pa rin siyang nitrate sa structure, but meron siyang dagdag sa structure niya. Just like this one, this is a nicotinamide nitrate ester na meron pa ring vasodilating property, and that is because of the presence of the nitrate. So parehas pa rin ng mechanism of action. Okay? So meron siyang vasodilating properties sa normal coronary arteries, but meron siyang more complex effects in patients with angina. So bale, dagdag lang ito sa listahan natin ng ating nitrates, si nicorandil. The same mechanism of action, the same vasodilating effects, especially in the normal coronary arteries, and it has a very complex activity, especially for patients with angina. Okay? So, sige. After our nitrates class, we have our calcium channel blockers. So, sa nitrates, siya, series of activities, nitric oxides before pa ma-reduce yung pagpasok ng calcium in the cells for the contraction. This time, si calcium channel blockers will really block the channel automatically, directly, and thus reducing contraction. So, most likely mahuhulog pa rin siyang parang vasodilator. Okay? Kasi walang contraction na mangyayari because of the reduction in the calcium. So, for our CCBs, syempre ang effective dito yung verapamil and diltiazem kasi these two yung merong selective action on the calcium channels found in the heart. Yung mga dihydropyridines kasi natin, yung nag-end sa dipine, more on the blood vessels sila, peripheral blood vessels. So the first drug, clinically useful na member ng CCB for our angina is the verapamil. So si verapamil actually was discovered when they were working on papaverine, which is alkaloid coming from Papaver somniferum. That's this same plant material where we get our morphine. Pero the papaverine is another alkaloid. So they were actually studying about that. Nag-synthesize sila ng analog of papaverine, which is actually a vasodilator alkaloid. Doon nabuo si verapamil class. Tapos yung sa dihydropyridine naman, ito yung pinakauna, si nifedipine. So please take note ha, verapamil and diltiazem are more on the calcium channels in the heart. Pero though it can also affect the blood vessels in the periphery, pero mas may effect kasi siya dun sa heart. Si dihydropyridines naman, yung mga nag-end sa dipines, more on the calcium channels, kulang pala ito. This one, vascular. So blood vessels. So this is concentrated in the blood vessels. Ito pwedeng sa heart mismo na blood vessels, pwede din sa blood vessels in the periphery. Pero more on the heart. So what are the effects of giving the patient calcium channel blockers? There will be reduced vascular resistance. Syempre, kasi the blood vessels, the smooth muscles in the blood vessels will relax kasi may reduction sa calcium supply. So pag ganon, ma-reduce din yung cardiac rate, especially since for our verapamil and diltiazem, they will also affect calcium channels found in the heart. Mare-reduce din yung cardiac force, and that means mare-reduce class yung oxygen demand. Okay? So this will be more on the demand than the supply. Okay? Mare-reduce yung demand ng oxygen. Okay? So we have mentioned CCBs when we studied hypertension and arrhythmias. Idagdag natin si angina. Pero anong gamit ng ating CCBs? They are prophylaxis for angina. So when you say prophylaxis, prevention. So bale magiging parang maintenance drug siya. Araw-araw nilang iinumin para the blood vessels will relax, and then lahat na yon, pati ang heart class, mare-reduce yung contraction, yung rate, para hindi masyadong mataas yung demand ng oxygen. Okay? And thus preventing episodes of chest pain. Okay? So si nimodipine, nicardipine, and verapamil are actually useful for hemorrhagic stroke. So aside from giving these drugs for angina, for hypertension, and arrhythmias, these 3 drugs can also be used for hemorrhagic stroke. So stroke is like, 'di ba sa brain, pag kailangan din ng brain class ng blood supply kasi kailangan din ng brain ng oxygen for it to function. Now, if magkakaroon ng obstruction dyan, pwedeng magkaroon ng patient ng stroke, especially if nag-rupture yung blood vessel kasi nga this is the blood vessel tapos napigilan na yung blood flow there. Syempre puputok na yan. So the patient may experience hemorrhagic stroke. Okay? And then pag gagamitin natin ito, syempre kasi class, 'di ba, magre-relax yung mga blood vessels diyan. Kaya ano siya, useful siya. And this tree is also can also reduce cerebral damage after thromboembolic stroke. So kapag ka-thromboembolic stroke lang, it doesn't mean na nag-rupture talaga yung blood vessel, no? Meron kang parang obstruction dyan. There is still blood flow class. Pero ayun na nga, may clot dyan na nakabara sa blood vessel. So pwede pa rin mag-experience ng patient ng stroke. This time, it's called thromboembolic stroke. Okay? And kapag ganito kasi class, ang problema, yung brain natin, yung kulang ng oxygen supply kasi hindi masyadong nakaka-flow ang blood. Okay, yun yung problema natin sa stroke. Iba yung coronary artery disease, sa heart talaga yon, eto sa brain. Pag sinabing stroke, it's on the brain. Okay, may clot na na-clog doon, so nakulangan ng oxygen supply yung brain, kaya nagkakaroon ng stroke. So aside sa actions on the heart and the blood vessels, itong tatlo pwede din sa stroke gamitin kasi they can relax the blood vessel. But however, toxicity, we have here cardiac depression, especially for verapamil and diltiazem, since they can inhibit the calcium channel, yung contractility ng heart bababa. Okay, kasi wala na masyadong calcium. And kung sobra-sobra na talaga, it can lead to cardiac arrest kasi nga hindi na magko-contract yung heart because of the deficiency in calcium. Bradycardia, this is syempre related to cardiac depression. Atrioventricular block, yung flow of the impulse para mag-contract siya, ano din yon, mababawasan din yon, magkakaroon ng blockade doon, and then it may also lead to heart failure pag masobrahan. Okay, so we need to monitor our patients. Now it's already time, so end ako dyan. We will continue with the beta blockers next meeting, and the newer anti-anginal drugs. Konting-konti na lang siya, and on Monday I may have to start another chapter.